We're honored. We're honored that you've joined us for this timely discussion during a summer of heat and smoke. While this webinar is virtual, the CDM office is located on the traditional territory of the Wendat, the Anishinaabe, Haudenosaunee, Métis, and the Mississaugas of the Credit. Toronto is within the lands protected by the Dish with One Spoon Treaty, and this agreement captures our responsibility to the land, including each other. As a settler, I grew up without knowledge of these responsibilities, and I now realize that this ignorance was the result of cultural genocide. The Truth and Reconciliation Commission of Canada describes this by saying that land is seized, populations are forcibly moved, languages are banned, leaders are persecuted, and families are disrupted to prevent the transmission of cultural values and identity from one generation to the next. At CDM, we recognize the disproportionate and unjust disparities that Indigenous peoples continue to face today due to racism and ongoing colonialism. We are committed to working to reduce these inequities as part of our work towards better Medicare. And I encourage you to reflect on the responsibilities and relations of the place where you're joining from, as well as to celebrate Indigenous resistance against actions that threaten the health of human and more than human beings in the land. And I welcome comments in the chat as well. Before we begin, there's also some housekeeping matters. This webinar is being recorded so that it can be shared. The chat is open and we'd love to hear from you. Let us know where you are and why this is important to you. This event will end in just under an hour. We'll start with a discussion between panelists and then take your questions. You can ask questions through the Q&A function. And thank you again for sharing your evening with us. I am thrilled to welcome two leaders that I admire, Doctors family physician, president of the Canadian Association of Physicians for the Environment, and co-founder of PARCS, Canada's National Nature Prescription Program, Nature and Health. And Dr. Lem has engaged in advocacy and policy work on issues ranging from extreme heat and hydraulic fracturing, labor standards in health, and is a member of the Decent Work and Health Network. Monika has a 14-year-old son. I see a message that is asking if I'm freezing. The world is very close to 1.5 degrees average temperature rise, but Canada is heating up twice as fast as the global average. And that's why we're here to learn about coping with heat and how better Medicare could save lives. And so, first of all, I just want to say thank you again and welcome our two panelists, Melissa and Monika. And I'm going to pose the first question to you, Melissa. I'm wondering, what does heat do to the body, and what are those physiologic health impacts of heat waves?
Thanks, Edward. A real pleasure to be joining you from the unceded and traditional territories of the Musqueam, Squamish, and Tsleil-Waututh Nations here in what is currently known as Vancouver. I'm going to answer your question in 1 minute, but I just want to start by thanking you and Canadian Doctors for Medicare for hosting this really important discussion and for inviting me and CAPE, the Canadian Association of Physicians for the Environment, to participate. Your CDM's work to protect and improve our universal publicly funded healthcare system in Canada is absolutely legendary. And we know that if we don't tackle the climate emergency by reducing our fossil fuel extraction and use, that we are not going to be able to sustain a high quality healthcare system in the future because of extreme events that we're talking about, like heat waves. Which brings me back to your question about what the physiologic health impacts of heat are. So our bodies are designed to operate in a narrow temperature range. And so just think about how unwell you feel when you have a fever of just 38 degrees, even just 1 degree Celsius above normal. And this is what's happening to our planet. Think of our planet as having a fever of 38.5 degrees Celsius right now, which means that things are not working as they should. But when our bodies heat up, initially your system gets to work trying to cool itself down. And this means your heart rate goes up to move blood to the skin for cooling. Your blood vessels start to dilate. So you get visible flushing and you start to sweat, which is our body's primary cooling mechanism. And if you can't manage to cool down, these symptoms can progress to heat exhaustion and potentially heat stroke, which is a medical emergency. Dehydration can impair your kidney function. You can develop muscle cramps because of that dehydration and electrolyte imbalances from sweating. Your respiratory rate goes up to try to supply the body with the oxygen and the air it needs to cool down. Sounds minor, but I've also seen wicked cases of heat rash, which happens when blocked sweat ducts trap the sweat under the skin. And so, like I mentioned, heat stroke is a life-threatening emergency. And the main way that lay people can differentiate this from heat exhaustion, which is serious but less life-threatening, is if the person in front of you becomes confused or has an altered level of consciousness or loses consciousness. And this means that their body's temperature control system is failing, and this means an immediate trip to the ER or calling 911 right away. And then I also want to touch on the mental health impacts of heat. Research tells us that when the heat goes up, mental health suffers. So domestic violence and other violent crimes rise. People get insomnia, and conditions like anxiety, depression, and psychosis can worsen. And there's also, unfortunately, a correlation between extreme heat and increased suicide rates. So from our heads to our toes, extreme heat driven by climate change can be incredibly harmful for our health.
No, thank you so much for that, Melissa. I mean, this is, all information that has been coming out, and there's more and more evidence on this. We know that several years ago in Montreal, when there was a heat wave, the emergency department visits for mental health issues increased as well. And so these are we're beginning to recognize how much heat can actually affect our bodies. I'm going to move to Monika because this is something we hear less about. I'm wondering, what are the population impacts of heat?
Off mute. Maybe first, just to echo Melissa's thank you for inviting me to be part of this. I was saying before we started, CDM has such a special place in my heart, having been involved for so many years. And it's very hard not to be involved with CDM after you've been. And so it's nice to be able to contribute in some way. And my worlds have kind of spanned between healthcare, primary care, and then public health, which is more around, how do we keep communities healthy? And just thinking about population impacts, I was thinking about how we all, I'm sure, have different stories about how heat is impacting our communities on a larger level. But today, where I live in Unama'ki, which is Cape Breton in Nova Scotia, there's a ban on all activities in the woods because there has been such significant drought conditions here, and there is such a worry about forest fires that the heat is now contributing to this risk of forest fires. And of course, heat also makes the air quality worse when there are forest fires. So, it's those balances of, the physical activity and benefits of being in nature now balanced against this significant risk of fire due to the heat that we've been experiencing. And I thought I'd just mention first kind of some of the language around heat. So we talk about heat warnings, which is typically when heat reaches a certain threshold. And that's different in different regions across the country because it's very much based on what the norm has been in that region. So you may see variations based on different temperatures. But then when we get to extreme heat events, that's when we're seeing 2 days or more of those high temperatures without the relief at night. And that night relief is really essential. So, for example, I have not had air conditioning in my house since I moved here 14 years ago, haven't really needed it. Got a heat pump last year, more to get off oil. And I'm very thankful that this year, for the first time, I have air conditioning because the temperatures have changed so much in those 14 years. And when we think about population health impacts, there's a number of different groups and people who are more vulnerable to health impacts of heat, and it often aligns with the same groups and people who may be more at risk in other climate related emergencies. But we think about people who are living in low income housing, for heat in particular, who don't have air conditioning or adequate insulation, people who are working in outdoor or non-temperature controlled indoor conditions. So think about agriculture, construction, or places like warehouses. People face those dangerous exposures. Migrant workers are at particular risk. People who are socially isolated, communities that don't have as much green space or have a lot of heat absorbing surfaces like asphalt. And these are all factors that have been created by different, often policy choices in the past that have made some of these groups more susceptible. A few other groups you might think about are people with limited mobility, people with chronic medical conditions, people who are pregnant, infants. It's really a wide range of people and groups that are affected at a population level. And I think also remembering, we are all impacted in some way, and sometimes those impacts of heat could be longer term, thinking about how we are, when you are infected by a heat illness, it's essentially an indication of some form of organ dysfunction in your body that is happening, and that can have longer term impacts. And then I just thought I'd highlight one, analysis that was done in BC after the heat dome in 2021, where many people died. It was a terrible situation, and the people that they saw that were at highest risk were people who were older, who had a level of what's called deprivation, which is a factor of different conditions like income and education and access to services, who had mental illness, who had substance use disorders and pre-existing illnesses. And then conversely, people who were more protected were people who lived in places with more green space and who were actually in a healthcare facility like a long-term facility because there was better temperature control. So those are some of the groups that we most think about in terms of heat planning and response when we're trying to think about who most needs the supports to be able to successfully get through these very hot conditions we're experiencing.
Thank you so much for that overview, Monica. I think this is a good reminder that, especially in healthcare, we think there's a big focus on healthcare responses and on personal actions, but it's important to consider these social determinants of health as well. And we know there's a lot of science behind, well, there's, the individual things, so such as using fans and air conditioners and heat pumps to cool our environment. But we also know that there's these system level actions that are potentially more impactful, that there can also be some tension between these, what we do individually and what can be achieved at the population level. So, one of the concerns with strategies such as widespread air conditioner use is how energy intensive and costly and how vulnerable to power outages it is. But at the same time, air conditioners can be essential and life-saving. I think there is some unfortunate understanding that although it can contribute to noise pollution and the urban heat island effect, as the temperature rises quickly, some of its use has become unavoidable. And so we recognize that it's an important service, but there are many other options that you've touched on, including, climate conscious transport and buildings and green spaces and shade as well. So I'm wondering, and I'll come back to you first, Monica, what are ways for people and communities to mitigate and adapt to the health effects of heat waves?
Yeah, so as you're saying, I think that, the individual actions remain quite important, and a big part of, I think, what we also do in public health and emergency preparedness in general is trying to make sure people have the information that they need to be able to, take care of themselves and their families as best as possible. So I will still, say, make sure you download the Environment Canada app so you can see the alerts, see the different recommendations that are out there, around, what is your level of what are your medical conditions and what are recommendations for levels of activity, that type of advice. Make sure you know where your cooling centers are. If you can get a portable air conditioner, make sure you have one room at least that you can stay cool in. And I think all of that is important. And, almost maybe one of the most important is making sure we're checking in with our community members who may not have others around them to care for them. But yeah, my world tends to be, how are we doing things to make sure that people are, able to make those decisions. So sure, if we're saying, you should be in a green space, you have that green space to get to. So the things that I would think about are things like housing. So what are the, retrofits that are happening with existing housing or new housing? How affordable is the energy that people are able to actually, run the fans and the air conditioners in their houses if that's what they're using at the moment, until we have better solutions than air conditioners for everybody. The occupational protections are really, really important. So making sure that workers who are in conditions where they are going to experience the heat more acutely, that they have the protections they need to be able to do so. Urban design, as you mentioned, is a significant part of how we can be addressing this. I think the social connectedness piece is really important. It's sometimes harder to measure. I think we know it when it's there. We can also cultivate it. I know one of our biggest learnings from in public health from the pandemic was, the relationships that we had before the emergency were some of the most important during an emergency. So it's really hard sometimes to create those relationships during the crisis. But if we're constantly looking at how are we connected with our communities, at an individual level, but definitely all of us in organizations, making sure we're creating those partnerships. And then also bringing it back to healthcare also. People need to be able to access healthcare. There needs to be those plans for the continuity of healthcare so that people are able to access those pieces. So I think some of those are just some of the different policy pieces that need to be in place to make sure communities and individuals are supported.
Yeah, I think that's so important. I'm sure that you find out about heat waves ahead of time because the media comes calling for you. But I use that Environment Canada app, and those heat alerts are so important. And I find that when I talk to friends and neighbors, sometimes they don't know what's coming and they haven't gotten ready for it, especially with the wildfire smoke that's more prevalent these days. It's the air quality alerts have been very helpful to make plans. I'm gonna switch over to you, Melissa, because I know you've done a ton of work and been leading a lot of work around nature prescribing. I'm wondering, how does proximity to non-human nature protect health?
Well, Monica mentioned it before when she was talking about different community measures to reduce heat. And so I'm going to reiterate what she said, which was that during the 2021 heat dome in BC, one of the significant risk factors for death that emerged was lack of proximity to green cover, or conversely, a protective effect was living within 100 meters in greenness after controlling for different confounders, because we know that income and greenness tend to move in inverse directions. So one big reason it makes a lot of sense if you think about it is that these neighborhoods are physically hotter because of the lack of shade and also lots of kind of hard built surfaces that hold onto and radiate heat. And when we think about who died during the heat dome, I really love that Monica mentioned greenness, because we typically think of those common risk factors like being isolated or elderly or having chronic diseases. But I want to reiterate that lack of neighborhood greenness is also a significant factor. And you're probably not going to be surprised that I'm going to say this, but nature is good for our health in all kinds of other ways. As co-founder of PARX, you mentioned Canada's National Nature Prescription Program. I'm really well acquainted with the research. Now there are over 10,000 peer-reviewed papers in the literature looking at the intersection between human health and green space. And so there's almost no health condition that nature doesn't make better, other than maybe adult allergies. And so we know that people who spend more time in nature and live closer to it have, for example, lower blood pressure. They have better pregnancy outcomes, better blood sugars. Kids who live close to nature have better school performance, and people overall have lower rates of anxiety and depression, again, after controlling for different factors like income and other confounders like pollution, air pollution. And we also know that about 5% of Canada's total greenhouse gas emissions come from our healthcare system. And the truth is that people are healthier. When people are healthier and happier, they use the healthcare system less. And not only that, but being healthier means that they're more resilient to the current and future health impacts of climate change that we're seeing, including heat and wildfire smoke. And something that's also great about people who are more connected to nature across the lifespan is that they're more likely to hold pro-environmental values and also engage in more pro-environmental behaviors like supporting conservation and green space, or like voting for climate advocates. So it's this virtuous cycle. I like to think that every time one of PARX's over 18,000 prescribers across the country issues a prescription for nature to patients, and so far we've issued over 1 million of them, that they're building this movement of people who care about protecting the planet and our green spaces, which which is going to reduce the urban heat island effect because over 80% of us live in cities, and improve our health overall.
Oh, thanks for that. I didn't know that it was the statistics were so dramatic. I'll add that there's a really great resource for any folks who are interested in finding out data on where you live. There's a group called the Canadian Urban Environment Health Research Consortium, CANU for short, CANU, and they've got this web-based tool called Healthy Plan. I think it's healthyplan.city that will show green spaces and other environmental considerations in many cities and towns across Canada. So, I am based in Toronto, so I had a look, and it's interesting to see these, how green spaces are dispersed through areas where I live, and it really touches on what Monika had talked about in terms of social determinants of health and marginalization, and also, what Melissa had mentioned as well in terms of where are the areas where people are more protected. I think also that it's such an important point that being close to nature is good for health, but also the healthcare system, as well as building sustainability and well-being into the future. I'm wondering, in terms of your health professional role as a family doctor, has this come up in your practice, and what else have you been seeing or doing as a family physician?
Do you mean have nature prescriptions come up in my practice?
Yeah, nature
Yeah.
prescriptions. Yeah.
Yes, absolutely. So I'm proud to say that I am the number one nature prescriber in Canada. I've issued the most nature prescriptions of all my colleagues. No surprise. So yes, it absolutely comes up in my practice, and often it comes up because people have heard about one of the new partnerships that we've launched, whether it's with Parks Canada for free Parks Canada Discovery Passes, or with the Canadian Museum of Nature for free entry for a whole family, or our most recent one with the Vancouver Art Gallery, where you can prescribe free visits to their Emily Carr room. So you can have an air-conditioned, indoor, nature-inspired art experience, which is especially important for people who, for example, can't go on a trail. If they can't walk or head out onto a trail, it's an accessible indoor area. So it does come up all the time. But you know what else comes up all the time in my practice is just dealing with the health impacts of climate change more generally, and also heat. Because in 2021, I lived through the heat dome, and I saw more patients with heat illness than I ever had in my entire career. And it made me, so I have to say, I wasn't as prepared as I wished I had been. Even though I've lived and kind of worked in this climate change space for a while, I wasn't prepared for the magnitude of what I was going to see, and it's made me think a lot about what I can do since then. And there are so many things that we can do, whether it's prescribing nature, whether it's systemic advocacy, from that micro level to the macro level. And so on a clinical level in the office, we should know how to identify and treat the symptoms of heat stroke and other heat illnesses. We should make sure our patients know how to adjust or change their medications, like say diuretics or stimulants during heat events, and also to be on the alert for possible side effects. Dr. Samantha Green, she's a member of Canadian Association of Physicians for the Environment on the board, and her work was recently covered in the Toronto Star around prescribing air conditioners to at-risk and lower-income patients, so that they can get financial assistance to cover the cost of these air conditioners, which is next best to electric heat pumps, but important life-saving medical equipment for a lot of people. And I want to point out, as a doctor. It might sound self-interested, but the research tells us that doctors and nurses are the most trusted professionals in the world. So when we speak up, people listen, and that includes politicians and decision makers. We can go beyond our offices and request meetings with our city councilors or MLAs or MPPs or MPs to push for those stronger policies to phase out fossil fuels and to keep our streets and our homes and buildings safe from the health effects of heat. There's so much we can do on a local level, but also on a more systemic level.
Great, thank you for that. And I was also at one of those clinics with Samantha as well, so I know well what you're talking about. It's a great initiative from CAPE and partners. Monika, I'm going to turn over to you. As a public health professional, I'm wondering, what is the role of public health? I know you've touched on it a little bit already, but just to hear about what it is like day to day to respond to a heat wave. And I'm wondering how could strengthening public health address the risk from heat waves?
Yeah, like I've worked in public health since 2008-ish, and I did my training before that. And there's definitely been a change over that time in terms of how much of a focus climate change has become. I think, it's good that it's, I think, fairly strong right now. I think, others were taking a lead in the past, and I think we are now often doing a good job of not, we can always do better. We are trying to make climate change more of a priority and heat in particular. So, for example, Ontario Public Health Standards talk about climate change. And in the health units I've worked at, we've tried to look at how climate change is a part of, say, all of the work that we do in some way. So, both making it clear that, all of our work can be connected to either improving or potentially having a negative impact on climate change. And then with heat in particular, like I think that is an area that has been a key part of public health work just because one of our core functions is around emergency preparedness. So this is a preparedness and response. So we've been involved with work like heat alert and response systems. That's a part where public health is often collaborating with our different community partners to make sure that we are both prepared and responding to appropriately. We are often part of the communication of different messages to the public in different ways, whether that's through media or written or collaborating with our community organizations. And then the understanding the population piece is often a big part of public health work. So that data piece, so what are the health impacts of heat or other climate related events, and being able to collect and analyze and share that data in a way that is truly useful. Um, I do think I was looking at Jay's comment earlier around, this is useful information and focus on mitigation and resilience. But obviously, there are significant contributors to climate change more generally, and that is why we are seeing a lot of these heat-related events. So I think, speaking to public health specifically, I think that is an area that we are becoming more involved in. I think it's more and more important. I live in a province where we get our power partly from coal. There's a coal mine that, is opened recently on Cape Breton. Like there are definitely areas that I think we could be as public health speaking to, why something may or may not be a way we should be doing things when we're thinking about, the immediate, like, yes, don't go in the forest today because there might be a fire. And then the bigger picture, what are we doing to not have this happen in the first place?
Yeah, such an important question, and thank you, Jay, for that, and also for Marilyn. And I do see that there's some questions that are popping up into the Q&A, so please, we're going to be coming to those soon. So please feel free to ask some questions using the Q&A button. And I think those community links, as you mentioned, Monika, are so important. I'm part of a research project that's being led by Professor Sarah Allen and researchers Stephanie Simpson and Melanie Seabrook. And it looks at collaborative public health action on extreme heat. And they found, diverse programs, cooling centers, wellness checks, street outreach. But the theme in common was a lack of funding as the greatest barrier to protecting health and heat waves. And, coming back to the Canadian Doctors for Medicare, unifying mission, it is so important to invest in these public systems that both improve the sustainability of our healthcare system, but also population health as well. Monika, I'm going to come back to one thing that you mentioned earlier, and just to ask a little bit more. You had talked about the impact on workers, and I'm just wondering how workplaces can reduce risks from heat.
Thanks, Edward. This is an area that there's so many areas I think are important. This I really spend a lot of time thinking about. We all spend so much time in our workplaces, and I heard a quote from a researcher who looks at the impact of heat on health, and he said, we want people to leave the workplace healthy. And it seems like such a simple statement. We all want to leave the workplace healthy, but when you go to work and you're working, say, 10 hours in an extreme heat event, you don't have, access to shade or water or sufficient access to all the protections you need. You are going to leave work less healthy than when you went to work. And that is absolutely not what we want to be seeing. And we are seeing increasing impacts of heat on both outdoor workers, but also indoor workers. So I mentioned warehouses earlier, and even if you're in an office building that does not have sufficient cooling, that is going to affect your health by the end of the day. The workers who tend to be at greatest risk are those, in places that they might be indoors with their air conditioning. So thinking about restaurant workers, people in bakeries, and then people who are exposed to hot weather outside, of course. So construction, agriculture, even things like motion picture locations shooting. And then another piece of this is, the workforce is changing. We are seeing especially older adults who are working longer years, longer days. And so a lot of our labor standards may not be with, that group in mind, or people with chronic medical conditions, or, sometimes even, women may not have been in mind when certain work standards were put in place. And then the last group I wanted to mention are groups like temporary foreign workers or people who are undocumented, who are often typically in agricultural or other types of work where they're outdoors, often with fewer protections, and then less ability to speak out against any, either violations or concerns because they are worried about their job, their citizenship status. And we know that people who are working lower income jobs are much more likely to be working under conditions that are much hotter. We are seeing some changes. I wanted to mention a few campaigns that are happening. There's a group called the Worker Solidarity Network, who I'm actually working with for my PhD, but they are in BC, and they have a campaign called Too Hot to Work, and they're really trying to emphasize some of the requirements that should be in labor standards to keep workers as safe as possible. They did a survey after the heat dome and gathered some excellent information. And 70% of workers said that they did not have adequate protections when they were at work. Somewhere like Ontario a few years ago, the government said that they were reviewing their requirements for being prepared for heat stress and having protections for workers. There was a consultation that went out, there was a commitment to that. Nothing has ever come from that, at least publicly. And then what's been said is people are pointed to a set of guidance that is voluntary, and there is not that requirement for employers for some of the pieces that should be in place. And of course, the other piece of this is enforcement. So you can have all the requirements that you want, but if there's not the pieces in place to enforce those requirements, so say with inspections that are, unannounced and other pieces like that, you end up relying on workers to put in complaints about their workplace, which is often very challenging for workers. So I think that is absolutely such a significant part, especially with heat, of the work that needs to be happening for, both adaptation and, to some extent mitigation, because, if we have workers that are in jobs that support a transition to a different kind of economy, and they're healthy and they are having proper work standards in place, like that is a good thing for the workers, and that is a good thing for all of us.
Yeah, and I see that there are some comments in the chat that are echoing this as well. And thank you for mentioning this, Monika, because CDM has supported in the past healthcare for all residents of Canada, including workers, regardless of immigration status, because we know that heat harms everyone, that workplaces that are unhealthy are not good for anyone in that workplace, and certainly not good for the healthcare system when people come in sicker for preventable illness. So important to touch on that. I'm going to pivot to, I think, my last question before we open it up to the Q&A, because I see that there are more questions now. So I started this conversation by noting that 2025 is among the hottest years in history, but what if we thought about 2025 as also potentially the coolest year for the rest of our lives? And when I heard that framing from a scientist, it really made me stop and think. And so I'm going to turn to you, Melissa. I'm wondering, how do we prevent heat waves? How do we stop this trajectory of hotter and hotter and hotter summers? What is the role of climate action to address these underlying causes?
Edward, I think we have to stop pouring fuel on the fire and stop the upstream cause of extreme heat, which is climate change driven by ongoing expansion of the fossil fuel industry. And I saw someone allude to that in the chat. whenever we hear a decision maker these days or industry talking about more pipelines or ongoing fossil fuel subsidies or more LNG export facilities or letting more buildings be hooked up to gas. They're directly supporting measures and policies that are locking in decades of more deadly and extreme heat and more heat stroke and heat illness. And this is why CAPE has been calling for multiple measures to phase out the fossil fuel industry, whether it's banning fossil fuel advertising, which drives demand and social license for fossil fuel use. At the same time, governments are trying to enact policies to reduce them. A couple of years ago, CAPE actually released an open letter that was endorsed by organizations representing over 700,000 health professionals across Canada, including the Royal College of Physicians and Surgeons of Canada, including the College of Family Physicians of Canada, which called for a policy federally to ban fossil fuel advertising. And we have made some headway on this. So about a year ago, CAPE helped get amendments to Bill C-59 passed, which actually made greenwashing illegal and immediately resulted in the websites of multiple fossil fuel organizations going dark. So we know, as we mentioned, individual action is really important, but systemic action can move the needle way further, way faster. I hear far too often from politicians at multiple levels that they're just not hearing from their constituents, from their community members, that climate change is a priority. So it's time to make it a priority. It's time to raise our voices together so that they hear us, because turning down extreme heat means turning down our use of fossil fuels, and that really requires systemic policy change, but also action all the way down to the grassroots to make that happen.
Oh, thanks so much for that. And I see, a comment with 5+ signs, Dr. Lem, and then 5 or 6 exclamation points. I think there's lots of nodding going on in the background here, but it's so important to mention that CAPE and CDM are both member-driven organizations, and one of the ways that being a member is so useful is that you can add your voice for these campaigns and build some unified pressure for these policy changes that we're looking for. I'll also add here that there was a 2021 report called Indigenous Resistance Against Carbon, and it documented the tremendous efforts made by land defenders that had halted or delayed an estimated 25% of greenhouse gas pollution in the US and Canada during the previous decade. And they pointed out that Indigenous sovereignty and self-determination, free from coercion and criminalization, are integral to a future that supports well-being as well. And so at this point, I think I've tired out Melissa and Monika with my questions. I'm going to turn to the audience, and I see that there is, the first one is from Marilyn Evans, and Marilyn says, how might we as society inform our children and youth about climate change, and in particular extreme heat, to empower them and not to instill fear? And I'll go to whoever wants to go first.
We're like right on the ball, Monika. You go ahead.
You know what? I'm going to admit I had looked at the question around medications and I was like, what are the medications that need to be in certain temperature zones? So I am sorry, I was working on another question.
I can answer this one then. Well, so there have been these global and Canadian surveys of youth and their mental health when it comes to climate change, eco-anxiety, and looking at the different factors that drive it. And basically almost one of the most important factors is that they feel like adults aren't doing enough. So namely decision makers and adults who run industry to fight the climate crisis. And so that's something I really take to heart. And so I have a 10-year-old son, and I think he's not an anxious kid, but you would think, like, given that I drag him around to all my events, he hears me talking about this all the time, that he would be concerned about it. And he is. We have conversations about the fossil fuel industry and climate change not infrequently. When he was 4, he actually made me a Mother's Day card with drawings of fracking wells on it. So this is how kind of steeped in his psychology these ideas are. But I think one of the reasons why he's not he's not so worried is because he sees me every single day working so hard to protect his future. Whether it's talking at events like this, whether it's organizing public events, whether it's meeting with decision makers. So I think for him, I'm a living example of an adult who's protecting him and his future by acting on climate change. And I think the more overt we can make that, the more we can talk about it, the more we can show our kids that we're taking action, the more we can shift messaging coming from government, the less anxious they'll be, because they will feel like adults are actually taking care of them. And then also preparation is a really important part of that. If you feel like you're prepared for coming future crises, you won't feel as anxious about that. And I know there's research that Dr. Courtney Howard did around wildfires, which showed that communities that felt most prepared also had the least anxiety around wildfires and wildfire smoke. So there's so many things we can do, but I think a really important part of it is showing through our actions and our words that collectively adults are taking action on climate change.
That's an inspiring way forward. And I feel like also perhaps it was at CAPE webinar that I saw where Britt Ray had talked about this issue as well. And I know she's done some work around this. I see that Jay Scott has also asked a question. I think we addressed it. So this was about oil and gas and efforts to block that. Jay, I hope we answered that question. I'm going to move on to the next one. And the next one's from an anonymous attendee who's a PhD student studying heat vulnerability, where they talk to individuals living with chronic conditions such as asthma or diabetes. We found that they often develop highly self-reliant coping strategies and less on public infrastructure like cooling centers or community programs. Many describe feeling like they're in an in-between category, not as visible at risk as seniors or unhoused individuals, but still deeply affected by extreme heat. I'm curious to hear your thoughts on this. How can we bring them closer to the city's resources and help them feel recognized and included?
I feel like that person who is studying this could probably give a really good answer to that because it sounds like that's what your focus is. One thought I was having is a big discussion in Nova Scotia is around, having registries or lists of people who may need supports if there is some kind of emergency, whether it's heat or otherwise. So that is one way to make sure that if your community does have something like that, then you can be part of that, depending on, sometimes there are criteria, sometimes it's, you sign yourself up, and that's been happening more in Nova Scotia. I think it is valuable to have that list of people. I think the debate is, who does it? What do you do with that information? Does it actually get acted on? Because it's a significant number of people in the end who would say probably they have a chronic condition. I think there's probably a role within kind of the healthcare system. I'm also a family physician, and it's the kind of thing I might talk about with my patients. I have a lot of patients who, are underhoused, unhoused, have, issues like they don't want to leave their belongings to go to a cooling shelter because it's all in one place and they can't bring it all and they're worried about being stolen. So there's, I think, a lot of different groups that are not always part of our current planning. And I think it's, incumbent on the people doing the planning, both to have individuals involved in the planning because they are the ones that can tell us what we need to be thinking about, but then also making sure that when we're putting things together, we're constantly thinking about who is not acknowledged in this plan, who needs to be part of it. And it sounds like work like yours will be really important to highlight the groups that need to be focused on.
I want to jump in on your answer to that, Monica, and I want to highlight how we need to bring organizations that aren't necessarily seen as kind of community resilience infrastructure for cooling and to address heat into the conversation. So I'm going to mention that the church I attend in Vancouver, Christ Church Cathedral, actually recently became the first non-city official cooling center in the city of Vancouver. And this happened because a group of seniors, actually, because anyway, a lot of seniors attend the church. They decided to organize and after the 2021 heat dome and decided we want to do something for our community that's within our capacity. And so they decided on their own speed to approach the city and ask, can we become a recognized cooling center? And in fact, so this came through, this agreement was signed over the past year. And an article was actually published in Vancouver's Awesome recently about that fact. And since then, what I've heard from church leadership is that other churches have reached out, other organizations have said, I had no idea that we could become a cooling center that was a non-city center, and we want to do the same as you. So if you think outside the box, if you can think of bringing non-traditional partners into this work, then essentially we won't necessarily need to bring people closer to the work, because the work will be brought closer to them. They'll be able to see themselves, they'll be able to access coolness in multiple locations across our cities.
Thanks for that, both of you, for those insights. I was talking to a member of a health authority in BC about responses that have evolved since the heat dome. And, they did talk about the need to prioritize groups that are at highest risk of death. And that may not, include everyone with asthma and diabetes, because there is such a diversity, but certainly there's a spectrum of risk. And, because of their lack of resources, they focused on prioritizing the folks who have highest risk of mortality. But in order to expand that, it's important to adequately recognize and the importance of public health, and to adequately fund that as well as those linkages to community organizations. And Melissa, I hear the importance of those non-traditional spaces. Anchor institutions is another way I've heard of them, including recreation centers, religious institutions, and libraries, and transit systems as well. So thank you for that. I have a short question about going back to physiology. There's an attendee saying, I have low blood pressure and carry salt with me. I understand that heat lowers my blood pressure. Quick one.
Did you want to take that, Monica? Because you started doing some research.
I'm thinking it through. So in terms of heat, decreasing your blood pressure. So if you're losing fluid because you are trying to, to regulate your temperature, so it does make sense that your fluid is going to decrease, your blood pressure is going to decrease. I think salt could help with that, but salt, the purpose of that is to draw fluid in, and you need to have the fluid there to be able to draw in, which, it links to needing to stay hydrated. So I think it's a bit of a cycle that, yes, you might have decreased blood pressure with heat. However, salt can work only if you have the fluid to bring in. I think there's also aspects to think about with blood pressure medication. So if you're taking medication for your blood pressure and you're decreasing your blood pressure kind of purposefully with that medication, that could also be a risk for health impacts. So you may want to also talk to your healthcare provider about ways you might adjust your medications at times. If you especially are starting to feel symptomatic, or if you have a blood pressure cuff at home and you're measuring your blood pressure and you're seeing that it's lower, there may be ways that, short term, you may want to make some adjustments there. I don't know, Melissa, does that cover things?
That sounds perfect. I don't know how much of a physiology lesson we want to get into, but the different ways your blood pressure drops. But yeah, absolutely want to back up the fact that if your blood pressure is dropping for another reason that's not heat, sometimes consuming a bit of salt can help with that. But if it's related to heat, typically it's because of vessel dilation, dehydration, and salt, like you said, Monica, is not going to address the dehydration. So fluids are really important in that case as well.
These are hard questions.
Yeah, that's a tough one. It seems, such a simple and elegant question, but there's a lot behind it. Definitely echo that. We see this in the emergency department a lot with heat-related syncope and people fainting. So it is important to stay hydrated. Okay, so Nicole has a question that we've touched on, but it's important to circle back to the details. So Nicole was talking about resources, discussing vulnerable groups, and wondering why those with diabetes are not often specifically mentioned, especially as extreme heat affects insulin, diabetic supplies, even diabetes itself related to heat stress leading to hyperglycemia. So just wondering if you have thoughts about that.
Yeah, I can try to take that one, which is that it often kind of falls under the umbrella of chronic disease. So often we say that people with pre-existing conditions are more vulnerable to the effects of heat, and also the effects of wildfire smoke, the effects of kind of other climate-driven disasters. And so diabetics are definitely one of those groups. And I think they're also one of the groups that qualifies you for example, to be able to claim an air conditioner as a medical expense on your taxes, and may also qualify you for other financial assistance if you have that condition. So I don't think it's not deliberate. It's not that health professionals aren't aware that diabetics are at more risk. It's just I think they just tend to fall under that category of pre-existing conditions and chronic disease. I don't know if you had other thoughts about that, Monica.
The only thing I was going to mention is one of the resources that I look at often. It's 2023 Vancouver Coastal Health Chief Medical Officer of Health report. And of the four conditions that are specifically mentioned, diabetes is one of them because it is such a common condition. So I would hope maybe you might see things changing, that you might see it mentioned more often, or if it just, as Melissa said, will come under that umbrella of conditions. And I think later on you had also asked about impact of heat on medications, and if someone is taking insulin, that would be one to think about because heat can degrade the insulin. So it is something that people may need to keep in mind, especially if their home is becoming increasingly hot. You know, we have to think about supply chains and things like that. You know, all these medications need to be transported, and we are very intricately connected with all kinds of different supply chains that are also things to worry about with different climate emergencies as well as heat. But and worry about it, but then it's also an area that, you know, as we build more resiliency and, you know, systems that will try to account for some of these conditions, hopefully we will find ways to be able to make sure medication, I need a different word than pipelines, medication pathways stay intact.
Yeah, that sounds like a useful pipeline. The next question comes from Tom Cullen, and this was not a plant, but I really like this question. As a volunteer advocate for climate action who regularly lobbies politicians, I have found that they tend to listen to physicians. Is there a mechanism to have the content of the seminar shared with MPs, MPPs, MLAs? So in the chat, Zarif has posted the website for CAPE, as well as Canadian Doctors for Medicare. And our goal is by recording this webinar, we will make it available. And if you sign up to our mailing list, you can see when it becomes available, or join we have a YouTube channel as well where it will pop up eventually. So thanks for that. Last question, from Sheila, how much personal variation is there in heat tolerance? Some people seem to adapt better, even enjoy heat. Others find it unbearable.
Well, I think Monica mentioned some of the different pre-existing conditions or different demographic groups that are more vulnerable to extreme heat. But even within those groups, absolutely, there are people who are more tolerant to and less tolerant of heat. And even within the same person, you can become more tolerant to and less tolerant of heat because it takes our bodies, our physiology, some time to adjust to new environments. So for example, an example is during the heat dome. Initially, when people were exposed to the heat, more deaths occurred after the heat buildup because of longer exposure. But also, one of the reasons why there was higher mortality was because we went through a not so hot period, and then suddenly heat kind of dropped on the lower mainland. And so we hadn't had a slow ramp up of temperatures that bodies can typically adapt to over time. So that's part of the issue. But yes, absolutely. I think just anecdotally, when I have patients who move from warmer countries to Canada, they're often complaining about how cold they are, and then after time they adjust. Similarly, when us poor people in Canada travel to hot countries, we're just sweating all over the place. But after some time there, often we do adapt. So there is interperson and intraperson variability in tolerance of heat.
Yeah, and then I was even just thinking about the different heat thresholds across the country. So, you know, a heat alert in Nova Scotia is slightly lower than a heat alert in Ontario, not because necessarily, you know, there's something that physiologically different between us, but, you know, we are typically more used to slightly cooler, although that's changing rapidly, conditions. And then just to add to Melissa's point, so things like workers' compensation claims for heat-related illnesses are going to be they're higher within the beginning of a season that is becoming hotter because people are less acclimatized and they're jumping to work, or when people just come back to work and they're thrown back into that environment, they are more likely to have some kind of illness in that type of setting.
Great, thank you both. I hope that answers the question, and I'm so sorry if we didn't get to your question. I am seeing that we're almost out of time though, and so I'd like to offer our two presenters maybe 30 seconds or a minute each just for final thoughts on heat waves, health, and our publicly funded healthcare system. Maybe I'll go with Melissa first.
Thanks, Edward. I just want to end by saying that every single one of us has a part to play in turning down the heat, whether it's clinical action in our healthcare settings to prepare and protect patients from heat, or joining conservation organizations in our cities and our provinces and federally, or joining organizations or donating to organizations like CDM and CAPE. Because reducing greenhouse gas emissions is healthcare. Reducing fossil fuel use is healthcare because climate change and fossil fuel use drive illness and mortality. So I hope you'll join CAPE. I hope you'll join CDM in the work that we do to protect patients and protect the planet.
Oh, I feel like that was a good ending statement, but maybe just to echo just that organizing piece and connecting with people, it just helps so much. And I'm thinking of work that Edward's also involved in is working with workers who are not part of unions, who may be feeling isolated from each other, who may not typically be connected for organizing, and then being able to come together for a common cause and change the conditions that they are working in. I think it's very similar around climate change and, that connection with other people and knowing you're all going through this, similar conditions and how do we change that? It can really, empower people, empower communities to be able to create change and appreciate the highlight of public health. Often we're more known around the outbreaks and communicable disease part of the work, which is also very connected to heat and climate change. But we also do a lot of work around surveillance, data surveillance, as well as public policy. So I was happy to be able to speak to some of that today.
That is a perfect way to end. Thank you both, and thank you so much, everyone, for joining us tonight for such an engaging discussion. Thanks also for Dr. Dutt and Dr. Lem for the work that you're doing to promote health in a climate and healthcare crisis. I'll add that if you're a medical student, resident, practicing or retired physician, and not yet a Canadian Doctors for Medicare member, please consider joining today. For everyone else, please consider signing up for our newsletter and the CAPE newsletter for updates and events. We're fortunate to have borrowed Dr. Lem from the Canadian Association of Physicians for the Environment, so please check out that amazing organization as well. As both of our speakers have said, there is strength in numbers, and it is only by coming together that we will bring about real change. We know that we have a lot of passionate and knowledgeable guests in the audience, and we look forward to working with you to strengthen and improve our public healthcare system. Thank you again, everyone, and have a wonderful night.